Christopher Morrison, MD. I'm a certified wound specialist and a fellow of the American College of Certified Wound Specialists, fellow of the American College of Hyperbaric Medicine, and board certified in hyperbaric medicine and family medicine as well. My original background is in sports medicine, and my interest really came from my significant interest in scuba diving and hyperbaric medicine. So as a sports medicine doctor, I found myself running hyperbaric chambers because of my interest in treating scuba divers. However, of course, the majority of the patients that we were placing in the chambers were wound care and vascular patients. So very simply, over a short period of time, I became very passionate about what we were able to do for these patients that were otherwise already on the schedule for an amputation. So we saw significant clinical outcomes and improvements by operating and implementing new advanced standards that I learned about at the SAWC. And when we learned about these different protocols and we implemented them and we saw what these changes were occurring, I became very passionate about we can really drive this as a specialty. So about 10 years ago, I essentially shifted my practice from sports medicine to wound care. I'm very passionate about the fact that wound care is a subspecialty. I think we need to be driving it as a subspecialty through educational programs, through attending SAWC, through reading the journals, and of course the development of fellowship programs in wound care and hyperbaric medicine.
I'm Harriet Jones. I'm currently the medical director of the Wound Care and Hyperbaric Center at River Oaks Hospital, which is in Flowood, Mississippi. We are an outpatient hospital-based program. I was a nurse for 9 years prior to returning to medical school. After I finished medical school, I entered an internal medicine residency and completed that. Then I did infectious diseases fellowship. I am boarded in internal medicine, and in 2005 I left the university from the infectious diseases division and started the wound program at River Oaks. My start in wound care began many years ago when I received my Bachelor of Science in Nursing at the University of Southern Mississippi in 1985. My first job after nursing school was in an operating room with orthopedic surgeons, and I spent the next 3 years in various operating room scenarios, then in recovery rooms, and then on an orthopedic floor where I took care of patients who had postoperative wounds. I really felt led to try to go back to medical school, and once I got into medical school, and then I chose internal medicine because I knew I didn't want to be a surgeon, because I like dealing with people more when they're awake. My husband and I then decided that it would be a good idea for just a good foundation of internal medicine, and then I fell in love with infectious diseases, which is one of the reasons that wounds don't get well is because they're infected, at least chronically perhaps, maybe not enough to make the patient systemically ill. But that's how I became a wound specialist.